Hi, my name is Marisela Cigliuti. I'm a registered nurse and owner of Mindfully Pain Free.
And hi, I'm Dr. Dana Hodges, physical therapist and owner of Rebound Physical Therapy. Today, we wanted to begin sharing our pain stories, and we're going to start with Marisela. Marisela, I want you to tell me about different symptoms that you've had in your life and what your journey has been, understanding those symptoms and living with them and coping with them, and then, trying to get treatment and figuring out what has helped you feel better.
Yeah, absolutely. Thank you, Dana. So for me, my symptoms started at 2011. I started experiencing a lot of back pain. And that's when I started to really go into different doctors' offices, physical therapy, spine surgeon, orthopedic doctors. And I was just really worried. I was working as a nurse night shift during that time, and it was very stressful. I mean, we were always short staffed. We always had to do a lot of lifting, short staff and working at night. A lot of people, obviously, they're just really asleep or just really, non-ambulatory. So it was very, very hard. So I thought I pulled a muscle or I did something wrong with my back after lifting a patient, and I just became so worried. It just sent me on this whole loop of fear. The good thing though is I think after 6 months I met with this amazing spine surgeon, and he was like, no, you don't need surgery right now. You're pretty good. He was just telling me that I just, keep exercising, keep moving. The only thing that he said that kind of stuck to my head was, your left side of your back, like your leg area, is just a little bit weaker than your right. And I was like, okay. He's like, but everything's fine. So I got better. And then I would say about 3 years ago, my back started to hurt again. And around that time, I was really facing a lot of stress because I think I was going to get laid off from a position that I was having. And I was just really afraid because it was a really comfortable job. I was working from home. I was just doing my thing, working my hours that I wanted to do. I loved the job. And then it was a temp to perm position, and they were hiring, permanent staff. And I hadn't heard back. And then eventually I did hear back, and the company told me, oh, you didn't get picked for the position. So I was like, oh my God, I was just terrified. So I started having a lot of pain in my back. So I was like, okay, so oh my God, my back pain is coming back again. So I went to do this cryotherapy. Are you familiar with this cryotherapy, which is like, I don't know, they put like cold therapy in your back? I don't know if you're familiar. They
Somewhat. I mean, there's different types of cryotherapy. Like I know it's gotten popular. Some places have like these cryotherapy chambers and stuff where you get
I
inside.
didn't go to that. I didn't go to that extreme, but they put like a little wand on my back. And I got to the car within, I would say 45 minutes. My back felt numb up down to like my butt area and my pelvic floor. And I was so panicked. I was terrified. I hadn't felt anything like that. A feeling of numbness and cold around that area. So that was the beginning of, multiple other symptoms that came along. Like I was having sciatica with my lower back pain. I was having what it's called piriformis, butt pain and pelvic pain. And I was just like, that's it. I'm done. I really felt really, really scared. Like all these symptoms came out of nowhere after that. I did have a surgery, I would say 9 months prior to the lower back pain, where I started having a lot of shifts of, symptoms, but they weren't pain. They were just like dizziness and like tachycardia, like anxiety. But the actual true pain symptoms started after that cryotherapy. I was like,
Gotcha.
that's it. I'm done,
Were
so.
you concerned like after the surgery that you had with some of those other symptoms that were coming up?
I was in full panic. My blood pressure was really, really high. I mean, my blood pressure was off the roof. I thought I even needed blood pressure medication. It was just I was just so afraid of what was happening with my body, and nobody can give me an answer. So right before the pain, after the surgery, oh, you got to go to this doctor and that doctor. And they were just kind of sending me to all these places. It was just like unbelievable. So then with the pain, I don't know what to do. So I went to my doctor, I went to an OBGYN doctor, multiple doctors. I actually went to like over 20 doctors.
Oh,
And
wow.
I tried like 3 to 5 physical therapists. And it wasn't until like I think right before my maybe my 43rd birthday, I was like, I'm done. I said, I am completely done with going to all these doctors because I kept going to them like every 2 weeks, like or every month. I had to do something or do like a therapy or I mean, I was just trying everything, alternative medicine, orthopedic doctors, orthopedic surgeons. The last doctor that kind of did it for me, he was an orthopedic doctor. And he must have touched like maybe 3 to 5 spots. And he's like, oh, those are the spots that really diagnose fibromyalgia. I was like, oh, okay. So I'm like, what does that mean? Well, you have fibromyalgia. I'll refer you to like a pain clinic. And, if you want to do alternative medicine, I'll give you a number to this person that does alternative medicine. And that was it. And I was like, I just couldn't, it was like a shock. I mean, fibromyalgia, I mean, that's like a huge diagnosis that you get.
Yeah, it
I
can be
know.
really scary when, you're given a diagnosis, especially if it's not something you're very familiar with. And yeah, it can seem like, yeah, like, oh,
It was
that's
just
it.
like, yeah, it was devastating. So there was a lot of hopelessness because the doctor wasn't really giving me options. He was just like, oh, this is fibromyalgia. This is the pain clinic. He's pretty good. And I was like, pain clinic? What are you talking about? I'm in my early 40s, I just couldn't see myself doing that. And I tried many, many different methods until I said, you know what? I'm just going to stop everything. And I just started doing mindfulness, and that's all I did. And I'm not saying that mindfulness completely cured my pain, but it just got me to a point in which I could sit because I wasn't able to sit with pelvic floor pain, if, for people out there with pelvic floor pain, that you really can't sit for more than 1 to 2 minutes. You are just like, I mean, on a spiral. And I actually had to I knew it was like, I was at my lowest point when my husband literally had to take me to pelvic floor therapy, like literally on our SUV with like the seats down. And I was kind of laying in the back as if I was going in a stretcher.
Oh,
Like,
no.
yeah, I mean, I'm laughing now, but like, I was like literally as if I was in a stretcher in our SUV. And I was like, I can't live like this. This is not, there has to be something. There has to be another way. Just never felt like what he was telling me, the orthopedic doctor, was the full truth of what was happening with me. I mean,
Yeah. So at that
it's,
point, when you had decided to drop all of your treatments, just to clarify for everyone, like what symptoms were you having? It sounds like some pelvic floor
yeah,
pain.
I was
Then,
having pelvic floor pain. I was having piriformis with the left buttock pain. Sciatica. My back wasn't hurting as much. I think what terrified me the most was the pelvic floor pain. So all that anxiety was there. So it was just, I mean, it was excruciating pain. All I did, I mean, I was still working from home. And the funny thing is I actually did get higher. It's just that back to the beginning, it's just that that person that gave me the information was giving me the wrong information. So I wasn't really fired from my job. I was actually hired. They just didn't have an answer for me at that time.
oh,
But by that time, I already was in pain. By that time, I was just like in full blown, panic mode with pain. So even though I did get the position that I wanted, it was just like I was already ill. Yeah.
gosh. So, and then how did you discover mindfulness? Because it sounds like you had gone, the typical traditional route that many of us take when
Mhm.
we're suffering from pain. We go and see physicians, we see physical therapists, we, try, hot and cold type treatments, right? Using heat or using like cryotherapy, things like that, or medication. So how did you make the shift to, I need to, try something else, something maybe a bit more alternative that
Yeah.
is less talked about and as the first intervention for pain?
Yeah, actually, I started listening to Dr. Schubiner. I don't know if you're familiar with him. And he has a little program, like it's a little, because at that time, many, many years ago, it was just very, very basic. Now he has multiple other programs. But I started enrolling in his program, and he did have some mindfulness videos to try. So I started doing some of the videos that he did, and then just started exploring outside from his program, different practices. And they just kind of made me more relaxed, and I started to feel a little bit less pain as I came along, to the point in which I felt like there was hope. There was hope. So I was like, even with this, I think there's hope. I'm just gonna stay with this, for now. I was very afraid to really start being dependent in medication. I think that was one of my biggest fears too.
Of course. Yeah. Do you mind sharing what medications you were taking or had been
Yeah.
prescribed at that time?
Yeah, I was taking muscle relaxers, different muscle relaxers that did help. They were pretty good. Um, but then they got to a point in which they wouldn't get rid of it. So pelvic floor pain is very, very challenging because I mean you can decrease the muscle relaxers decrease obviously some of the discomfort, but you're drowsy, you're not yourself, you want to go to sleep, you're tired. And I think sometimes the pelvic floor therapy is actually triggers more pain, to be honest with you. It was actually worse. One time, the last time I said, I'm never coming back here again, I said that actually twice to pelvic floor therapy.
No.
It was I was like, this is horrible. I can't do this again. I said, I can't really do this again. So I said mindfulness. And then I just kind of, once it started to work a little bit, I would just stop taking any muscle relaxers. I just said not enough, but I was prescribed like different, like even suppositories, because they have different suppositories or pelvic floor treatments. They also have just different like wands for you to use wands to decrease the any issues, with the tightness and the discomfort of the pelvic floor. Just many different modalities that just didn't really work. They just worked maybe for a little bit and then just didn't.
Yeah, just
Yeah.
temporary relief. So
Yeah.
for like how long would you have relief for? Like a day or two or only a few
No,
hours?
I wish. Only minutes.
Minutes.
Yeah. So the pelvic pain that I had, it's something that as soon as I woke up, and went to sleep, it was always there. Except when I would get up and walk, there'll be times that, I wouldn't have any pain. And now thinking back, it made me realize that also I would actually wake up in the middle of the night with my arms like completely numb. I would actually wake up because my arms were numb. I don't know if you've heard that before, but
Mhm.
like literally just wake up and I'm like, oh my God, my arms are so numb. I think it had to do obviously because of so much fear around that diagnosis of fibromyalgia. There's so much fear around it. Like every single symptom I was having. I even had like a cardiologist check me out, had endocrinology. I mean, just all these different therapies. I was even placed in like hormone therapy, thinking it was that. So I eventually weaned myself off of everything. And I said, what's another option? What's another option for me? So I did start looking into mindfulness. Then I started looking into Dr. Sarno's work with emotions. And then I just ended up doing pain reprocessing therapy, which has sort of changed the way, I feel about pain. I was mostly thinking that it was based on my emotions at first. And then what pain reprocessing therapy does is just pretty much teaches you that it's really a brain induced pain due to, this danger signal that we have, which is really our autonomic nervous system. So I started to just really change the way I see pain. It takes a while, but I can control it now. I'm able to self-manage now. Whereas before I was completely out of control. Like I just couldn't.
So about how long have you been delving into mindfulness and then now the pain reprocessing therapy? How long have you been doing that?
3 years.
Okay.
Yeah, 3 years. Yeah, it's not an easy road. A lot of things have come forward with that. When you start doing mindfulness, a lot of things come forward as far as like childhood adversity events, that I had, that a lot of people obviously that have pelvic pain or chronic pain suffer because they have a lot of multiple adversity events in their childhood. Also, just different things have come up. But what has helped me was really the relationship you have within yourself with mindfulness. It really allows you to have more compassion for yourself, have more patience, you know. One of the things that I think that always triggers my pain is my perfectionism. I don't know if that's something that, yeah, I think it's just important to know that perfectionism just really, really triggers pain.
Oh, for sure. Yeah. I am a recovering perfectionist myself.
Yeah.
Becoming much more aware of that mental tendency that I have as I've become an adult. So yeah, it can play a huge role in driving up our stress
Yeah,
and also therefore our pain level if we are experiencing pain.
yeah, absolutely. Tell us a little bit about your pain story, how it got started and any flare-ups that you still have and so forth.
Yeah, sure thing. So probably the main incident of pain that I've had in my life has been when I first graduated from physical therapy school. And I took a full-time job in an outpatient clinic. We mostly treated pain at the clinic. So orthopedics, people that had surgeries, all that kind of thing. So I was doing a lot of hands-on work with clients, some of what we call like manual therapy and physical therapy, which a lot of people would um, think of as some of it involves like massage techniques, but also, other hands-on treatments to treat joints and just make people feel more comfortable. And also a lot of, guiding clients through exercise. For anyone that's been to physical therapy, you probably realize that being a physical therapist is a very physical job for the
Mm.
therapist as well as for the client. And so I was very active at work. I was working long hours. I was working about like 50-hour weeks, give or take, sometimes more. And the life of a healthcare worker also involves lots of documentation.
Mm.
Now, unfortunately, on the computer instead of so much on paper. And so it was a lot of typing. And, I was adjusting to the job. I tend to be, like I mentioned before, sometimes like I'm kind of work myself too hard, right? And so I had really high expectations for myself. I was probably over documenting, like just typing even more than I needed to into the computer about my patient visits. And so it was definitely, getting used to the physical aspects of the job. I had been working in different settings, of course, as a student as well when I was in school, but the adjustment to really working full time in a paid position, I felt a lot more pressure at that point when I'd first started the job of like, oh, like I need to make sure my documentation is correct and all of this that you feel, so certainly looking back on it, I realized like how much pressure I was putting on myself at the time. And when you're in the moment, you don't always realize it as much. You're just trying to cope. You're trying to, do the best that you can at your job. I've always been a really hard worker. So I just wanted to do my best. And anyway, so within about maybe a month and a half of starting this job, I started developing wrist pain on both sides, so both wrists. I noticed it more when I was typing. If I would sit in front of this computer it was a tiny little portable computer, smaller than a typical laptop, like it was a Chromebook that I was using. And so the keyboard was actually smaller than like a standard size keyboard on a laptop.
Mm.
And I'd never really used one of those computers before. And so at the time, I really chalked it up to, oh, well, I guess I'm having some issue with typing on this tiny keyboard. That must be it, and so the problem kind of kept getting worse over several weeks. And I started having like pain doing other things as well, not just typing. If I was doing like hands-on work with a client, I would start to feel like this achiness kind of come on sometimes in my, wrists. And at the time, I also thought, well, gosh, maybe I like injured my wrists doing some hands-on technique with a client, because of course, I was still adjusting to everything physical in my job. And so I thought maybe, it's that. So my mind was definitely only thinking about physical things at that point in time. As a physical therapist, of course, I'm trained to think that way, rather than thinking so much about any sort of stress that I was under that might be contributing to it as well. And it was interesting, like I had never had really any pain like this before. I think of myself as an athlete. So, I played tennis my whole life. I have done yoga for many years now. Like my body is used to doing lots of like physically demanding things around like that part of my body that was bothering me, my wrists. And so it was surprising to me and to other people that I worked with that I was like having this issue. I was a bit embarrassed too, because it got to the point where I started to need like a wrist brace. So I went out to a pharmacy and I bought just like an over-the-counter, wrist braces. And I would put them on when I was typing at work. I was embarrassed I didn't really want to wear them when I was working with clients. That certainly doesn't give people the best impression if you're working with an injured physical therapist. So I tried to not do that so much. Plus, it was a bit limiting. If you're wearing a wrist brace, you can't do as much with your wrists. But I was able to type. So I'd use it to type. And finally, probably maybe, I don't know, several weeks into this, like a month into this, I ended up deciding that I needed to buy a keyboard that I could use. So I ordered a keyboard online that was ergonomic, a much wider keyboard. It was very comfortable. As soon as I got it, definitely my pain level went down, but it did not go completely away. I was really thinking that, like this is going to fix the problem. And I'm sure there was some, stress reduction around that decision too, of like getting a keyboard and starting to try a new method to help ease the pain. So that might have helped. I had some hope around this new thing. And physically, I'm sure it did help some to like change the position of my wrist when I was typing. But I really thought the problem would go away and that would be the end of it. But it didn't. It lingered. It was at a much lower level, but I had this kind of dull achiness right around both of my wrists that would come on mostly with typing, but sometimes with other physical things too, in my job or even in tennis sometimes. Or if I would just grab things like grab a doorknob or a steering wheel, sometimes it would come on. And it would be mostly like achy, but then it would be like really sharp sometimes too, just kind of right at my wrist area. And it was weird. Because it was kind of generally more of a, like, I would call it like a mild pain. It was more of like an annoyance in my life. And so for a while, I really didn't do that much about it. After the initial pain kind of calmed down, when I changed keyboards and, I was also, I think I had done a lot of, cryotherapy. So using ice, I would just apply ice to my wrists, like, ice packs when I got home, or put my hands in like a tub of like, cold water with some ice to try to help that. At one point, my dad suggested Voltaren gel. So I think at that point, you still had to have a prescription for that. So I used some of his. And, I couldn't really tell if it was helping or not, but it was just one of those things. I'm going to try it. So I would put it on. I would put it on at work. I would bring it with me and I would like put it on my wrists in the bathroom sometimes at work, just hoping that it would help because I just wasn't really sure what to do. So I lived like that for a while, but it was just more of an annoyance level. And then a little over a year after these symptoms started, I remember one day I was at work and I started noticing like tingling and stuff,
Mm.
like mostly like a tingling feeling in, I think it was just one of my hands at that point. And I kind of immediately, I was like, this is weird. Like, I haven't felt that before. And reflecting on it later, I realized I was definitely like kind of freaking out about the symptom, like right away. That was kind of immediately where my mind went, rather than just kind of taking note of what was I felt in my body. I was immediately like kind of freaking out about it. And so, I just kind of continued to feel some tingling. And then I think a week or two later, I remember I went on like a vacation with my husband, and we went on like this trail that involved a lot of like climbing and rock scrambling and like ladders and everything. So it was a pretty physical day that we had, where I was like gripping things with my hands, and we had a great time. It was like beautiful weather. We both love hiking, so it was fun. But I remember that night sleeping, I woke up in the middle of the night and both of my hands felt very heavy and very like numb. And that scared me, because I had remembered feeling like the tingling in my fingers not that long before. So I was definitely like concerned immediately. And again, in retrospect, like I was freaking out, and it would have been better if I had been more calm, of course. But I think probably part of the issue too was because I have training in physical therapy.
Mm.
You've been taught all of these things that can possibly like go wrong with you. And so when you start to feel something, your mind kind of immediately jumps to like analyzing, like, oh, what could it be? What's going on? And that's not, unfortunately, as we talk more, on this channel about pain, that's not the best, definitely not the best way to react when something's going on in your body. It can often flare up pain and other health problems more when we like analyze and worry, and we're too critical about all of these things going on in our bodies, kind of almost like a hypochondriac or something. So anyway, my mental tendencies at that point were not really helping me very much with this issue. So the tingling, I continued to have like heaviness in my hands at night, kind of going forward. I tried to do ice. I ended up seeing a good friend of mine who was really good at dry needling. So that was like one modality that I tried that I hadn't really done much with before, I don't think. And so she did a lot of like, I wanted her to do some needling of like my forearms to try to like relax like my muscles that were contributing to, muscles and tendons passing through my wrist area. I ended up consulting a colleague of mine that was a hand therapist at work. And occasionally I would have him like do treatments for me as well, with like neural tension and things like that. Just basically, these are hands-on techniques to try to like relax the nerves and any sort of muscle tension and nerve tension that might be in the upper part of the body, like in the neck and in the shoulders, and passing down through into the hands, which sometimes can contribute to pain. So that was also more of like a physical approach to trying to solve this problem. And I found like my colleague working with me to be relaxing, but I didn't really notice much of a difference either with, that. And the dry needling was, to be honest, it was painful. And, but I had dry needling done before, more like in school and stuff. So I was familiar with it, and it wasn't really like, I wasn't like scared of this technique or anything. For some people, dry needling can be super helpful. But in my case, it didn't really end up, helping to change the symptoms that I was having. So at that point, I think I finally ended up going and seeing my primary care physician, because of my training and because of where I was working and the people that I knew. unlike other people and, different scenarios, I did not go and see a physician like right away about this problem. I kind of thought I knew what was going on. I wanted to take control of what, was going on. And I knew enough people that could look at me, that I didn't really need to go to a physician right away. But finally, after more than a year of this happening, I decided I wanted something done. And so I went and saw my primary care physician, and me being in the medical profession, I discussed with him, like, maybe I should have some blood work done. Like, I'm having pain on both of my wrists. Like, what is going on? Is there some sort of inflammatory issue going on in my body? Like, maybe I have rheumatoid arthritis and it's just starting to come on. Like, I was in my early 30s at that point. So I just wasn't sure. So I had some basic blood work done because the doctor didn't really have other suggestions at that point either. And of course, it was all normal. So that was reassuring. And I was, of course, glad that it was normal, but, I had to figure out what else to do. Then I think later I ended up requesting to have a referral to like a hand surgeon, because I was still having these carpal tunnel syndrome like symptoms. So I went and saw the surgeon for a brief consultation. Then she sent me to a pain specialist doctor that did what's called a nerve conduction study. So they look at the median nerve, which is the nerve that's involved in carpal tunnel syndrome, to see if it's compressed as it passes through like the bones in the wrist, what's called the carpal tunnel. And he also looked at the ulnar nerve, which also passes down the arm into the hand, just to test the function of that nerve. And, I was relieved to know that all of the testing was normal that day. He was able to tell me, when I was in the room with him doing the testing, that everything was normal. So it was a relief. But again, there were questions like, okay, like, so why am I having this tingling? Like, these were the thoughts that I was having in my head. Like, what is really going on? And around that time, I was fortunate having access to a lot of practitioners, that just through my training. So I actually saw a former physical therapy professor of mine, amazing therapist, and I wanted her to do like a full exam just on like the upper part of my body and everything, to see like if she thought I was really having carpal tunnel syndrome or what this was. This was actually, I think, before I had the nerve conduction study done. So there weren't any like definitive results yet. And she, from what she could tell, I wasn't having true carpal tunnel syndrome. The symptoms and the severity and everything, it just wasn't really in line with, what a typical physical exam would have been for that condition. So it was reassuring again, and I was grateful to have someone spend that time with me and do that. But more questions. And so, I guess around all of this time, I sought help from practitioners. I wanted more testing done. And once I kind of knew that, okay, well, the function of my nerves at least appears to be normal with this testing, I think overall it was reassuring, and having normal testing, normal blood work and stuff helped me move from a psychological state of like freak out mode and panic more towards just understanding that, like I'm going to be okay. Like, I'm okay. There's nothing that they can really find that's like, wrong. Doing these like physical tests and, the nerve conduction study. So I need to just try to, relax about this issue a little bit more. And I had gotten definitely caught up in the trap of the fear avoidance cycle, as I'm sure you did as well, Marisela, in your journey. You know, we try, if we make a connection with a certain activity, you know, that is provoking our symptoms, then a lot of people tend to immediately, like, you know, the tendency would be to avoid that activity, right, completely, or as much as possible, in order to avoid the pain. And some people don't do that. Some people kind of push through pain more, and that's kind of more their main like coping strategy. But mine has definitely been avoidance. And so even though I was a tennis player my entire life, the months around when I was getting all of this testing done and treatment, I had really stopped playing tennis. I kind of taken a break from it because I was concerned that I was going to make the tingling in my fingers worse. I had stopped doing yoga. I would still run. At that point, I was running pretty frequently. And so I kept that up. But even that, at that point in time, the like shocking and the like vibration and the pounding on the pavement sometimes would kind of bother my hands and my wrists. And I would get like achy pain or like sharp pain or the tingling. So I was just trying to do what I could to stay active, but I was avoiding things that I loved. And, you know, it was tough. And so around that point, I finally decided, you know, I need to stop freaking out and just try to get back to doing some of these activities that I love. And also, I can say that, you know, in my physical therapy training, we certainly did get exposed to information about chronic pain or persistent pain, and a lot of the neurological mechanisms, you know, behind, like, you know, all of the contributing factors to this type of pain, and how it's different from, you know, pain that just comes on with like an actual tissue, you know, injury to a certain body part, and then that recovery process. At this point in time, even if I had had some sort of tendonitis or something legitimately that had developed initially when I took my job, it was like it was well over a year, like a year and a half. And so that should have been healed like within 3 months, 6 months, like the tissues in my body, like all of that, it would have healed at that point. So I was no longer dealing with like a tendonitis. I was dealing with, you know, a persistent pain issue that had developed around my wrists and around my stress and my anxiety. That was what I ultimately realized was, you know, contributing to that. And so I was fortunate that a lot of the time the pain had been kind of dull and, you know, more of an annoyance than anything when it was like achy. But because I had chosen to avoid a lot of activities and things, some of my responses were, I was like maybe a little bit too paranoid or too freaked out by everything. And that worry and anxiety around my symptoms really, I think, ramped them up. And so for me, when I finally kind of let a lot of that stress go and around the symptoms, I started to feel better. And fortunately, really within a few months after that, it was kind of crazy too, because this was a few years ago, right around when the pandemic was starting, which is like such a time of like high stress for everyone. And I was fortunate that my wrist pain at that point was kind of starting to like, you know, go away. But something weird did happen around that time. I had a rash that broke out across my entire back and neck, and it was like hives. So it was just painful and itchy and just awful. And so I think that honestly probably was some sort of stress response to like the whole taking in the news of, the fact that this pandemic is coming and, there's going to be shutdowns and all of this stuff. And it was crazy. I'd never had anything like that before. And fortunately, it did calm down over a few months. I would get a few hives that would pop up here and there, but then within a few months, it was mostly gone. But, just craziness. But I was grateful that the wrist pain really at that point was not so much of an issue. But yeah, I guess I think what helped me was I did have some exposure even initially when my symptoms first started around the wrist pain, that I had exposure to the ideas that not all pain is provoked by tissue injury and by some physical cause in the body. I knew that. I had exposure to that in my training. And so it was always a little bit in the back of my mind, like the whole time that this was going on, that, maybe there's something else going on here. And it's, and so by the time after I had the testing, I kind of just started to relax around everything. And that made all the difference. So just exposure to that knowledge that, it's not always something in your physical body. Sometimes it's our thought processes, our behaviors around, these symptoms that sometimes can be the fuel for the fire, right? It's what perpetuates it. So.
Yeah, absolutely. I completely agree with that. And I mean, it's great that you had the training that it's not all physical and that pain is not only based on harm and injury. And I think that kind of helped you. But as far as for nursing, all our training is really physical. And I think that there is a small section on psychosomatic type of symptoms, but we see it as something that's like maybe like a psychiatric disorder. I don't know if you have that also with, physical therapy. That people say that because there's no injury, there's no physical cause, that is psychosomatic, and that is seen as something that's negative, unfortunately.
Yeah, unfortunately, I think there's still a lot of stigma in healthcare in general around, any sort of stress-induced symptoms, and they can be labeled as psychosomatic, and then just the patient's just kind of written off as, oh, well, there's nothing we can do or whatever. And that's definitely a problem. The narrative, I think, needs to improve around that. Yes, stress, of course, can induce symptoms, but I think the narrative around it shouldn't always be that that's like a terrible thing or a negative thing. I mean, it can be a really positive thing knowing that, because it means that not everyone that has a terrible pain problem needs some sort of physical intervention, right? Not everyone needs surgery. Not everyone needs injections, or other more invasive treatments. Like a lot of treatment that is very effective for persistent or chronic pain is around our thought processes, changing our behaviors, learning how to relax, learning how to understand like our mind, and where our mind goes and what it tends to focus on, when we're having a problem, like all of these things. So yeah, but I would say, in my physical therapy training, it wasn't super comprehensive with going into more of like, the neurological and the nervous system and how, all of these changes that can happen in our nervous system when we are in a state of persistent pain. But it certainly touched on it. And the main people that we were exposed to were Lorimer Mosley and David Butler, that are these amazing pain scientists and physical therapists and educators that are based out of Australia. And so we watched some of their videos, and And I had known about them even before I started PT school because I had taken an interest in some of
Oh,
that. There were some other, practitioners as well in the physical therapy world that we were exposed to a little bit, but certainly in introductory education, even in a graduate program, which is what physical therapy is, it can't go that in depth into all of these topics. And so this has really been something I've taken an interest in more as I had this issue with my wrist myself and experienced what that's like, and also just working with clients and out of school, and researching more about all of the ways that we can, help people that are suffering from persistent pain. So
absolutely. Absolutely. Thank you, Dr. Dana. I think that we're pretty much towards the end of this episode, and I think it's just really important to note that pain is a danger signal, and it's not necessarily caused of bodily harm. And in our next episode, we're going to touch a little bit about the educators that kind of got us started in both of our businesses, as far as working with mind body techniques, whether they're physical therapy, for yourself, Dr. Dana, or myself using mindfulness. So I hope you can join us. Thank you.